Yusek, ito ba yung face-to-face now, no? Yung phasing in? Do we actually see an expansion of this even before the school year ends in, I don't know, March na ba ngayon or April, no? Kasi iba-iba na mga schedules, no? But are we seeing more schools joining face-to-face well, what do you call them, trials or phase-ins, even before March?
Yes, certainly. In fact, the original number of 120 pilot schools, and if you will recall, the approval of the Office of the President for this pilot came at the height of the surge of the Delta variant. And because of the improvement in the COVID situation, the Department of Education through the Secretary has recommended to the President the expansion even of the schools participating in the pilot, as well as already to give DOH and Deped the flexibility to determine the final number of pilot schools. It has been approved by the office of by the President through the Executive Secretary, but with the condition that it will still not depart from the pilot character. We are accelerating the completion of the pilot phase. We intend to submit our report of the pilot to the President by end of December, and we anticipate a recommendation of an expansion by early next year. So yes,
Pero same level
we will be
ba to,
expanding.
Yusek? Pareho pa rin? Or are we going to do it in a secondary level, yung mga, di ba, 6th, 7th, or even
Yes,
11th grade?
we have a standing technical working group jointly between the Department of Education and Department of Health, and our discussion is after this pilot phase, we will already be expanding to higher grade levels in the expansion phase next year. So that will already cover not just the first key stage of K to 3, but all the way to senior high school.
Yusek, you described the first day of the pilot as generally successful. Ano naman po yung mga glitches na nakita ninyo? Marami-rami ba?
Well, some of the glitches were, one, there were 3 schools, public schools, that were not able to immediately commence the pilot face-to-face classes because a few teachers have tested positive with antigen. They were retested for confirmatory testing of RT-PCR, and they have tested negative, and so they will be starting, as far as I know, tomorrow. So it was deferred only by a few days. But we must emphasize that these things are part of the pilot. This is a test of our contingent measures for events like this. We have a COVID task force on the ground that is a coordination between the DepEd personnel, school leaders, teachers, as well as local government units, the local health authorities, as well as the parents and barangay officials. So there is a, and I have seen this. I went to a pilot school in Polillo Island. I've seen the preparations, and we are the internalization of the joint guidelines by DepEd and DOH is high. The principle of shared responsibility is there. You've seen some photos probably of the conduct, and it's doable as we have seen.
But where is the, I mean, for lack of a better term, the weakest link? Or kailangan pang pagtuunan? Among all of those sectors, who would you call out in particular just to say, now, ito, medyo kailangan lang natin ayusin yung hanay natin?
Well, I think that the weakest link will be on contingent variables like, let's say, infection that will affect, for example, a household. And we know that it is in the treatment side that it is often a shock to a certain household. So I think that is a matter that we feel a strong burden, and that is why we have insisted on a principle of shared responsibility because unlike the young kids going to the malls with their parents, it's really like there is not much that they expect out of responsibility, for example, in a mall owner. But you talk about the school system, and it's like you have the burden of public policy on your back. And really, it is a matter that we have to carefully work out with all of the stakeholders. And at the treatment side, it is something that is outside of the fiscal purview of the Department of Education. It is not covered by our budget. And so, in other words, it is reflected by I think, the area that is problematic even in our general management of the COVID situation.